Good morning, dear friends. My name is Vascularized. I am the hand transplant patient from Innsbruck, Austria, and the founder of the Voice of VCR Patients. Welcome to the interview. This time our guest is Professor Scott Levin, the past chairman of the orthopedic surgery department at Penn Medicine in Philadelphia. Professor Levin has an exceptional background. After training in pediatric orthopedic surgery at Rhine hospitals, he spent nearly 20 years at Duke University, specializing in congenital hand surgery. Professor Levin is the founding member of ICVCA and one of the founding presidents of ISRT. Let's talk to the outstanding surgeon and one of the foundational figures in the field of VCA. Good morning, Professor Levin. It's a pleasure to see you.
Good morning. Guten Tag. Guten Tag.
Guten Tag. Professor Levin, let me start our conversation with a quote of a Scottish surgeon of the 18th century, Sir Charles Bell. He said, "The hands are the ready instruments of the mind." You know this quote. Could you please give an interpretation of this quote in the context of the hand transplantation?
Sure. Well, Vasily, can you hear me okay? Can you hear me?
Yes. Yes.
Yeah. So Charles Bell was the most prominent surgical figure at that time, and he drew a remarkable conclusion that the brain somehow is connected to the hands. This was before MRI, before the development of EMG, before the development of many things in medicine, but he correlated the brain controlling the hand. And this was particularly relevant to Zion Harvey, the first child in the world to have bilateral hand transplants, in that at 2 years of age, he lost his hands, and we transplanted him at 8 years of age. Zion is now 18 and has excellent function. That being said, the loss of the hands, or congenital hand loss, results in the lack of development of the homunculus, which is the area of the brain that has representation of hands, lips, face, and other body parts. So this was a very profound statement by Bell. And then with modern imaging techniques, such as functional MRI, or what we call diffusion tension imaging, we can actually see the connections from the brain to the peripheral organs. So medicine has advanced in the last 200 years a lot, and but the correlation, or the relationship with the brain and the hand, the complex hand, one of the most complex tools in the world, remains.
So to say, we can say that sensation and the functions of the hands are the instruments of the brain. Can we say that?
Jawohl, jawohl.
Yeah, Professor Levin, you have mentioned it, the Zion story. May I tell our viewers that Zion is a boy who lost his hands at the age of 2, and at the age of 8, 2 hands were transplanted to him at Penn Medicine. During 6 years, his brain didn't develop any connections with his hands. And could we say that that after the hand transplantation, his brain could find those lost connections and reconnect with the hands?
That's exactly right, Vasily. We studied him with functional MRI, and the centers in his brain expanded after his hand transplant. So this gives, in concept, some promise someday to maybe children with congenital limb loss, they may be candidates for transplant.
Professor Levin, it is a very difficult issue. I mean, the pediatric the donation for VC. And in Zion's story, in Zion's case, was it difficult for you to find an appropriate donor for him? And was there a necessary legislation for pediatric external organ donation in that time?
Yeah. So first of all, two excellent questions. Number one, the donor pool, the potential donors at that time was extremely, extremely small. As a matter of fact, based on the United Network for Organ Sharing, which is our organ procurement agency in the United States that controls all of solid organ and VCA transplant, there were only 15 children that would be eligible. And we found, so that's number one. Number two, there was not specific government legislation, Vasily, but hours and hours and hours of discussion about the ethical considerations. But Zion, if you remember, for your listeners, Zion was already immunosuppressed. He had a kidney transplant from his mother, so it made a little more different.
Yes. Yes, you're right. Yeah. So to say, there was a lot of ethical challenges in this case, and you could, so to say, convince authorities and yes, ethical, this ethical problems of.
Yeah, we were able to not convince, but we had a ethics committee that approved us going forward. We still had to do it, but it was ethically validated, which was very important at the time.
Professor Levin, let us go a little bit back in time. I would like to ask you what did inspire you to start with the hand transplant program at Penn Medicine? You knew personally very well your colleagues, pioneers of the field, Professor Warren Branderbacher, Professor Jean-Michel Dubernard. And what did inspire you to start with your hand transplant program? You wanted to connect their work, or was it the story of your patients? Maybe the story of your first hand transplant patient, Lindsay.
Yeah, well, exactly correct. You know, Lindsay S. is an amazing, amazing person, a beautiful woman, a very courageous person like yourself, has great courage, great strength, great integrity, great commitment. And Warren Breidenbach was my teacher in Louisville. And I had tried so hard at Duke University to establish a VCA program, because Lindsay first came to me at Duke. And the Department of Surgery, the institution, the transplant people had no interest in VCA. I begged them, please let us develop a program. Vasily, please. This wonderful woman, Lindsay S. And Warren Breidenbach was very, very helpful and very supportive. But the healthcare system at Duke would not allow me to move forward. And, and then I had the offer to go to the University of Pennsylvania as the chairman of orthopedics. I was the chief of plastic surgery. I'm boarded in both specialties. I have a certification in plastic surgery, orthopedics, and hand surgery. So the day I arrived at the University of Pennsylvania, I met Dr. Avi Shaked, Abraham Shaked, who's the director. At the time, he was the director of the Penn Transplant Institute. I said, Dr. Shaked, I want to do a hand transplant at Penn. He said, of course, why not? And 2 years later, Lindsay followed me to the University of Pennsylvania. September 11th, 2011, 9/11, we transplanted. And here she is, you know, almost 15 years later with functioning hands like yourself. And that's the story. That's the story.
Yeah. Prof. Levin, I would also like to ask you about your cooperation with Professor Laurent Lantieri and his team from the Hospital Georges Pompidou in Paris. Yes, you had two hand transplantation of two. You have conducted two hand transplantation of two French patients, Laura and Priscilla, and one patient from Switzerland. How could you do that? Yeah, transplant logistic, the costs. How did it work? Could you tell us a little bit about that too?
Well, first of all, Professor Laurent Lantieri is a spectacular person, a spectacular surgeon, totally committed to restoring dignity in VCA patients, has done amazing work in face allotransplantation, and is one of the most committed and honest physicians that I know. And he's also my dear friend. But I met him, I think I met him in Valencia when Pedro had a meeting many years ago. We met, and he has been a source of inspiration to me and Vasily for certain reasons. He had some issues getting these two beautiful women, Laura and Priscilla, transplanted in France. I don't know the details, but we had transplanted Lindsay, we had transplanted Zion. We had a very excellent team. And he approached me and asked, hey, can you maybe, if I refer these patients to you, can you? So in a very close partnership, professionally, personally, we did Laura first, the first transcontinental VCA in the world. And, you know, we were able to bring Laura to the United States for evaluation, and subsequently was transplanted and is doing beautifully. As a matter of fact, she has a little baby by the name of Noah. Not so little anymore. She's a girl. And because of that success was followed by Priscilla, who had a transformative experience, again, a transatlantic transplantation, who again has done beautifully and has restored many things in her life that she did not have. And so I have to give tremendous recognition to Professor Laurent Lanteri, who has courage, who is honest, who is passionate about VCA, and has done so much for the field. It's incredible. So I'm very proud of what we have done together, but he is an outstanding leader in VCA. And he, honestly, Vesely, and for your listeners, Laurent, like Warren Breidenbach, like Max Dubernard, these people inspired me, inspired me to do my best, because the field has to grow. The VCA field must grow and become standard of care. The standard of care for somebody with no arms or legs is to have a hand transplant if they desire. If they desire. And so, coming back to the story, Dr. Lanteri has been a very instrumental part of VCA around the world.
Professor Levin, did these patients have to wait in the US for the donor or in France? How did it work?
Well, we did both. The most recent patient from Switzerland actually came and waited several weeks in the United States, and we found a donor. Laura came from France, and Priscilla, the day that Priscilla came to New York on vacation, and she was landing the airplane, I had a phone call. We have a donor. So Priscilla literally landed in the United States, and instead of a vacation, she came to the University of Pennsylvania. I had to find her. I called France. She wasn't there. Where is Priscilla? She was in New York. So very interesting experience. But both of these courageous women have done beautifully and are doing extremely well, like yourself.
Professor Levin, thank you. I'm going to ask you one more question about the hand transplant program at Penn Medicine. Are your colleagues going to continue with the hand transplant program, or it has been stopped?
Absolutely continuing. We are continuing forever, Vasily. We have 2 additional patients that we have evaluated that are candidates, and the Penn program, to my knowledge, is the only active program in the United States now. Active meaning we're evaluating patients. Perhaps New York University also has a program, but we are active. We're evaluating patients. We're considering patients, and we've also seen victims from the Ukraine war. So we have several soldiers who are bilateral amputees and blind that may be. So we can continue to evaluate patients, yes. And we have
Have other types of external organ transplantation been done at Penn Medicine, or only hand transplantations?
No, we have a very active, successful uterus transplant program at Penn. So we have uterus and we have hand.
Professor Levin, it seems to me that some patients don't completely understand that they graft don't always last forever. And could you explain to our viewers, please, are there any options for patients who lost their transplanted hands? Is it retransplantation possible in this case or not?
Well, that's a very good question. I believe, similar to face, that if needed, Vasily, if needed, retransplantation is possible. If retransplantation should be possible. Of course, the donor selection is important. The logistics would have to be worked out, but this would be a controlled, if you will, almost elective retransplantation. It's been done twice in face. There have been 2 face transplants that have been retransplanted, and there may be a need for either chronic rejection or loss of function, the need to do retransplantation. If you ask me, even though there would be challenges related to the immunology and antibodies and HLA typing and so forth, we can do it. The medical field could do it. So I think it's going to follow the story of heart, liver, kidney. As you know, sometimes kidneys are retransplanted.
Yeah.
Hearts, lungs, face. So if retransplantation is needed, I think it would be possible.
Prof. And do we have a long-term data on VCA graft survival or not? Or do we need this data? Do you know something about that?
Yeah, well, first of all, you know, what do we say is long term? 5 years, 10 years, 20 years. You know that Matt Scott, who was the first patient transplanted by Warren Breidenbach, now his hand transplant is 26 years old. 26 years. That's pretty long-term follow-up. Lindsay is almost 14, going on 15 years. Okay. Sion, 10 years. Look at you. When were you transplanted, Vasily? What year?
The 27th of May, 2005.
Okay, my friend. More than 20 years. So I think that's, you know, you have had hands, right, for 20 years. Can you imagine life without these hands? You had life without these hands.
Difficult, Professor Levin. You know my story. Yeah, it would be impossible for me to marry my girlfriend, to have a daughter, and so on. Yes, I wouldn't have done this without hands.
Yeah, look at Laura has a beautiful daughter. She may not have done that without hands. So there are many reasons to continue and develop the field of VCA. Many reasons to continue.
Professor Levin, I would like to ask you one educational question. We have started talking about nerve regeneration. Yes, could you tell, please, is it really key to restore the function and sensation of the hands? Yes, that the nerve regeneration would start just after the hand transplantation. How long does it take from the point of connection till the fingertips to grow through the transplanted hand, the nerve, for the nerve to grow through the transplanted hand? How long does it take, and how important is it?
Well, first of all, it's critically important.
Mhm.
If there is no nerve regeneration, then that's a failure of the VCA.
Mhm.
In our most recent patient from Switzerland, and this
Mhm.
also is related to the calcineurin inhibitors, tacrolimus, and some of the drugs help with the nerve regeneration. Within
Mhm.
within 8 or 9 weeks, we saw ultrasound showing muscle movement, and now,
Mhm.
let's say 9 months, uh, patient Luca from Switzerland has incredible function and
Mhm.
some protective sensation that will only get better. And the more proximal the nerve repair, the more distance the nerve regeneration has to travel. But
Mhm.
nerve regeneration in well done nerve repair is reliable and is the essence, the critical factor for functioning of hand VCA. And so far in our series, all of the patients have recovered motor function, which is critically important, as you know.
Mhm.
Yeah,
Mhm.
nerve regeneration, Vasily, is very critical, and it
Mhm.
takes it's probably the most determining factor in hand VCA success is nerve regeneration.
And how long does it take, Professor Levin? For example, from the elbow till the fingertips, how long grows the nerve? Does the nerve grow?
I'd say a year.
A year.
Yeah.
Mm. Professor Levin, what are your hopes for the future development of the field? And how do you think, what is the most difficult thing to overcome? What is the thing that holds VCN back and get doesn't allow the VCA move forward? Where is the
Well,
problem?
yeah. Well, in the United States, what is holding VCA back is the fact that today insurance or the government will not pay for this procedure. Insurance or the United States government, health agencies will not pay anything. So that's a critical fact that is preventing deserving patients from being considered and being transplanted. Okay.
Mhm.
Around the world, what's holding the field back is the awareness that this is possible. Okay.
Mhm.
You had your hands transplanted 20 years ago. If you walked up to people on the street in Austria and say, can we transplant hands? Many would say, that's impossible. Okay. So I think that we, the patients, the doctors, the researchers, the nurses, uh, policy makers, we have to work together vastly. This is too important an advance in the field of transplantation to give up now. And in India, and my
Mhm.
good friend Simon Kay in Leeds,
Mhm.
Professor Leonard, Professor Simon Kay,
Mhm.
our Indian colleagues, Mohit Sharma, who you
Mahesh
saw,
Sharma, yeah.
yeah,
Mhm.
they're doing amazing work and have
Mhm.
transplanted many patients. So
About 40 patients in India, I think. Yes, hand transplantation patient.
40 maybe, yeah. What what
Mhm.
is, what is possible today is needed today. We know this is possible, and in select certain patients, it's needed. It's the right
Mhm.
thing to do. and it should be standard of care, the standard of care around the world for patients who desire hand transplant, who are candidates for hand transplant, who have failed the use of prosthetics or have rejected the use of prosthetics for whatever reason. This should be a viable alternative. And I'm going to fight for this. I'm going to fight personally for this until I die.
Yeah, I support you, Professor Levin. You know, as well as I can, always. Professor Levin,
I support you.
Thank you. I see. Today it is very, yes, very important for patients, for ordinary people to know, in details, what VCA is, what immune suppression therapy is, and so on. We will explain this in our talks with your colleagues, and many of your colleagues have supported our patient initiative, Professor Simon Talbot, Professor Leonard, Professor Brodach, and many others. Professor Levin, my last question, about VCA, about you, about your life. How has VCA changed you as a person? How has it affected you? And what does it mean for you to give people not only hands, but also ability to feel, to act, and to live a new life with new hands?
Yeah, Vasily, that's a beautiful question, and I will tell you as my friend, and all the VCA patients and anyone who listens to this. This has been the biggest reward of my career, to work in VCA, to establish VCA at the University of Pennsylvania, to support patients like yourself. There are five beautiful gifts that I've received. And the gifts are Lindsay, Zion, Priscilla, Laura, and Luca. But I'm very honored and humbled by the fact that even though the pathway was very difficult, lots of people, as you know, say, no, you cannot do it. No, it's impossible. It won't work. Don't try. We can't do it. 5 beautiful gifts in my life, and it's been the greatest reward of my career to be involved in this wonderful field. And I thank you for inviting me to talk to you. We've seen each other around the world, but I want to explain to you that I will do everything for the VCA community I can to continue to support and develop the field. Everything.
Thank you very much, Professor Levin. You have a big authority. You are a very respected man in this field. I hope that you will achieve your goal, our goal, so to say. Yes, Professor Levin, thank you very much for your time. It is a pleasure to talk to you, and I'm very grateful to you for supporting our patient initiative and for raising awareness about VCA. Many thanks from all patients, doctors, and everyone who is involved in the field. Many thanks.
Vielen Dank und mein Freund, auf Wiedersehen. Auf Wiedersehen.
Yeah, have a nice day. Have a nice day.
Tschüss.
See you.
Auf Wiedersehen.
Tschüss.